My name is Ngozi Onyachonam, and today in our psychopharmacology class presentation, we'll be talking about paliperidone, which is drug of choice for me today. The information I have about paliperidone is that it comes in tablets and injections. So it's used in treating schizophrenia and schizoaffective disorder in adults and adolescents. Um, the medication findings show that schizoaffective disorder and schizophrenia can lead to significant cognitive impairment due to dopamine dysregulation. So, in using paliperidone, you don't have a lot of side effects coming from the use of paliperidone. So, in treating schizophrenia in adolescents who are 12 years to 17 years, the dosage ranges from 3 milligrams and upwards of 12 milligrams as needed when you're using tablets. And then for injections, you use 234 milligrams as needed and upwards as needed. In treating schizoaffective disorder in adults, you use 6 milligrams by either you increase it or you taper it down as needed. And then you start with 234 milligrams when it's injection. Either you increase or you taper it down. So the case presentation today, it explores the data, efficacy, and safety profile of one monthly paliperidone injectable in treating schizophrenia in an elderly Caucasian woman, and her starting dose was 150 milligrams and 100 milligrams on treatment days 1 and 8, respectively. Subsequent doses were administered at a 4-weekly interval. Once monthly paliperidone long-acting injectable is new and approved for acute management and maintenance treatment of schizophrenia in adults. Treatment of schizophrenia in Australia was experimented by using paliperidone, the tablets, and the injectables, and they were administered in doses of every 4 weeks as opposed to fortnightly. And this can be administered without oral supplementation with minimal hepatic metabolism, resulting in fewer drug interaction. So, initial evaluation, a case study of a 68-year-old Caucasian woman who has a history of 45 years resistant schizophrenia. And then she has gone over 30 hospitalizations, and most times they were prolonged, most times voluntary and involuntary. So her risk factor, the prolonged up to the on prolonged hospitalization, the risk factors were compliance with treatment by this patient. So studies have shown that uh, current psychotic treatments with paliperidone contribute to increased suicide rates. So studies also suggest that an overview of an antipsychotic drug for treating schizophrenia and schizoaffective disorder, but through exploring the pharmacological and clinical properties of and safety of this medication. So these patients, over the years, had exhibited significant history of impaired insight, non-compliance to treatment regimen, poor engagement in psych services, and self-harming behavior. The patient's current condition, that despite being managed in combination of clozapine 250 milligrams and zuclopentixol 400 milligrams with augmentation from sodium valproate 1000 milligrams, the control of her psychotic symptoms remained fluctuating with frequent relapses. So the relapses encompassed grandiose, persecutory delusions, and sexually disinhibited behaviors and elevated irritable effects. Her behaviors were secondary to alcohol binging and non-compliance with medications, particularly with fortnightly discomforting cyclopentixol injection. So, this patient was also diagnosed with Parkinson at age 34, which is being managed as well. So, studies monitored the primary efficacy and variable changes in both positive and negative syndrome scale. So, this patient, why is it appropriate to use paliperidone? Improvements were noted when she was being treated with paliperidone in three of the safety assessment variables, and these are BARS baseline score dropped from 4 to 1, signaling complete resolution of patient akathisia. And then there was a clinical evidence that were associated with lower incidence of extrapyramidal side effects. Then there were progress reports on this patient because her quality of life increased as measured with the WHO QOL breath measuring scale standard. It improved over 28-week period. Patients N score in each domain, including physical, psychological, social, and environmental, they were all above national average. The patient improved in mental state, and there was a reduction in relapse episode through observation period. There were some barriers to this treatment. Despite positive findings and efficacy and overall quality of life, safety evaluation yielded less favorable finding with regards to pre-established safety variables. There were issues of diabetes, which was an underlying issue with this patient. So the blood pressure control was not very favorable because it increased. And then we noticed that there was a rate of cardiovascular disorder and osteoporosis and breast cancer. There was also the issue of culture that was observed in but this in this case the person was of a less cultural background, so the person did not have issue with culture. Then in addition there was addiction too, because the patient treatment regimen seemed improved and her psychotic symptoms were assessed, and the efficacy of the variables that were used showed a reduced psychotic behavior. Lessons learned: there should be need for larger studies for paliperidone in elderly population due to issues related to tolerance and conventional antipsychotics. Then there's a scarcity of case studies were noted in the aging population. So these are the issues, and then likely they have longer history of illness, major comorbidities, and likeliness of polypharmacy. So on the other hand, there was another case of a 47-year-old man without any known psychiatric history, but who developed symptoms including delusions and infidelity, and had homicidal plans against his wife after 10 months of levodopa carbidopa on when it was used due to, and then there was gel insertion. The patient diagnosed with Parkinson's disease at age 34 who was being managed. The current condition of that patient, development of the patient's psychiatric symptoms was most likely related to insertion and self-controlling of dopamine. Infusion leading to admission into psychiatric ward. The patient again started with quatepine, 800 milligrams, with no improvement apart from hearing sedation. Then a clozapine treatment was started, titrated up to 250 milligrams a day, but the patient stopped the medications and was not compliant with it. Then evidence showed that research shows that the incidence of psychosis ranging from 3% to 30%, including usual auditory and pyramidal ideations, developed in these patients, and are all regarding the side effects of dopamine therapies. Therefore, psychotic symptoms are now considered a result of intricate interaction between the disease and treatment related to effects showing cause of psychosis. The appropriate use of injections instead of tablets were not they, compared to oral medications, and this showed constant blood levels of the drug and fewer dose-related adverse effects. Progress reports on patients were monitored due to monthly switching of risperidone and was given as syrup up to 1.5 milligrams. Finally, a trial of paliperidone was initiated following the switching, and 1 month later, the patient showed improvement and reunited with family. So the barriers is that the patient was controlling how much dopamine he was infusing, which might have worsened psychotic symptoms. Other barriers were the patient's compliance at times, other medical conditions such as comorbidities. So case reports in Saudi Arabia taking into control cultural and emotional competencies in treatment. Psychotic symptoms might occur in context of other medical conditions or treatment and need to be studied. Lessons learned: more educational research and studies are needed in studying and reviewing psychiatric cases and treatment. Baseline cognitive function assessment must be established for every research and study. Difference exists between oral and injectables. So, because depending on the patient's response to unique treatments.